Chapter 8. Non-neoplastic diseases of the bone. Condition: periapical cementoosteosis dysplasia. Cause is unknown. It occurs over the age of 30 and more prevalent in female than male. More common in African Americans as well. The location is the anterior mandible. The clinical features are asymptomatic with vital teeth. The radiographic features include a well-defined radiolucency to radiopacity at areas at the tooth apex. There is no treatment, and the diagnostic process includes historical, clinical, and radiographic. Florid cementoosteosis dysplasia. Cause is unknown. Occurs in people over the age of 40 years old. It occurs more in female than in male, and it also occurs more in African Americans. The location is the multiple areas of maxilla and the mandible. There is no symptoms, and the radiographic features include multiple areas of radiolucency to radiopacity. There is no treatment unless it's complicated by osteomyelitis, and it is diagnosed historically, clinically, and no extension, and radiographically. Focal cementoosteosis dysplasia. Cause is unknown. The age range is 30 to 50 years old, occurring more in female than in males. It occurs also more in Caucasians. The location is the posterior mandible. Clinical features are asymptomatic. Radiographically, a well-defined radiolucency to radiopacity. There is no treatment, and it can be diagnosed microscopically and radiographically. Fibrous dysplasia. Cause unknown. The monostotic type occurs more in children and young adults, equally in male and female, and the polystotic occurs in children, more prevalent in females than male. The location of the monostotic is the maxilla over the mandible, ribs, femur, and the tibia. The polystotic occurs more than one bone involved, the skull, the clavicle, long bones. Craniofacial type, the maxilla and adjacent bones. The Jaffe type, more than one bone involved, and the Albright syndrome is many bones involved. Clinical features of all types include enlargement of involved bones, the maxilla, the mandible, malocclusion, tipping, or displacement of the teeth. The Jaffe type and Albright syndrome occurs a café a lot macules on the skin, extensive progressive bone involvement, and endocrine abnormalities. Radiographically, diffuse ground glass appearance of radiolucency, abnormal bone blends into normal bone. Unilocular and multilocular radiolucencies have been described. Treatment includes surgical recontour of affected bone for cosmetic reasons. The diagnosis is radiographic, clinical, and microscopic. Paget disease of the bone. Chronic metabolic bone disease. Cause unknown. Age older than 50, occurring more in males than females. The location is typically the pelvis and spinal column. When affected, the jaws, the maxilla is more affected than the mandible. Clinically, enlargement of the involved bone. Patients may complain of pain in affected bone. With involvement of the maxilla or the mandible, spacing between the teeth increases. When edentulous, dentures no longer will fit. Radiographically, patchy radiolucencies and radiopacities, a cotton wool appearance, and hypercementosis and loss of lamina are also described. The treatment is experimental, and diagnostics include radiographs, clinical, laboratory, and elevated serum alkaline phosphates. Central giant cell granuloma. Cause is unknown. Occurring in children and young adults, the location is within bone of the maxilla and mandible, usually anterior segments. There is usually no symptoms. Radiographically, a unilocular to multilocular radiolucency. Divergence of tooth root is also common in this disease. The treatment is surgical excision, and the diagnosis is microscopic. Aneurysmal bone cyst. Cause unknown. Associated with other bone diseases. The age is under 30 years old, occurring more in females than it does in males. The location is within the bone of the maxilla and the mandible. There are no symptoms unless the bone is expanding. Radiographically, it's a multilocular radiolucency, and the treatment is surgical, excision, supplemental, and cryotherapy. The diagnosis process is microscopic. Osteomalacia. Cause: long-term deficiency of calcium in children, a nutritional deficiency of vitamin D, adults malabsorption syndrome, drugs, liver disease, kidney disease, chronic use of antacids. The age is the age, race, and sex. In children, it causes rickets. In adults, it's osteomalacia. Location is generalized bone disease. Clinical features include, in children, delayed tooth eruption, pathologic fractures, periodontal disease. Radiographically, subtle changes in bone trabeculation. The treatment of children is vitamin D and dietary calcium. Adults is dependent on the cause.